20,000 confirmed cases. New York has become ground zero for coronavirus. City hospitals are sounding the alarm about how quickly they'll run out of supplies, out of beds, and out of manpower. Contessa Brewer is downtown with more on how the city and state are bracing for what's to come. Contessa?
Look, Kelly, today the New York governor says that he has a two-pronged plan of attack. The first is to reduce the rate of spread. He's doing that by ordering non-essential businesses to shut down. Financial district has emptied out. He wants people to stay at home. What we're seeing is that there's at least 10 states now that have issued these stay-at-home orders, and even more states that are shutting down non-essential businesses. The second plan of attack here in New York is to increase hospital capacity. You mentioned those 20,000 coronavirus cases. That's 1% of all global cases at this point, and 13% of those cases have to be admitted to the hospital. So the governor said today that hospitals have to aim to double their bed capacity, especially those ICU beds. But he says they're required to get an additional 50%. And then FEMA and the Army Corps of Engineers is coming in to set up emergency hospitals. At the Javits Center, for instance, we know that there will be at least 1,000 beds. These will be for non-COVID-19 patients, so they won't be the patients who are going to be acutely treated in the hospitals. And then you need additional health care workers to deal with all these extra beds. The governor has a plan for that.
We are going to the entire retired community, healthcare professionals, and who are licensed, registered, and we're saying we want you to enlist to help.
He says he's had 30,000 responses so far. And remember, these are people who already have been licensed. They're already ready to go. He says the insurance industry employs an awful lot of doctors and nurses, and he needs them now in the hospital and not working in their insurance industry. And once more, he has called on the president to install the Defense Production Act. The American Medical Association is adding its voice, saying that the president needs to nationalize or force the production of these masks so that the states are not competing against each other, Kelly, and driving up the prices.
Yeah, and it's so eerie to see the streets empty behind you. Contessa, thanks. Contessa Brewer in Manhattan for us. Coming up.